The hygiene hypothesis suggests that we have been over-sanitizing ourselves. So the question around, are we, to prevent bad bacteria from colonizing our skin, we've been historically using antimicrobial cleansers or harsh things to remove the bad bacteria, to prevent things from colonizing our skin. But in so doing, we're affecting the good microorganisms that also live on our skin. So what we're trying to understand now is, instead of using antimicrobial cleansers, maybe just using mild cleansers is appropriate for removing any dirt and germs you pick up in the environment, but preserving the good bacteria that live on your skin. So in a healthy skin barrier, you have a diverse microbiome, and that means many different types of bacteria and in relative distributions, various distributions of the skin. And so we know what that looks like in healthy skin. And in atopic patients, what you see is when the flare starts to occur, that diversity goes down significantly. And you see Staphylococcus species coming into that microbiome, specifically, and in particular in babies, Staphylococcus aureus. And so what we want to do is help support the development of that diversity by using barrier therapies like lotions and creams that support the barrier and as such alter that environment, rehydrate it, help lower the pH, so pH appropriate products are important to support the good bacteria that need to come back into that ecosystem. So what we do, and what we especially do at Johnson's, is we clinically test our products. So this is very important to know that we're not making assumptions about it's mild, so it must be mild to the microbiome. We should test and make sure, especially in this emerging space where we're obviously also in kids and infants, where we see the microbiome is constantly changing. So a product at one point might not be appropriate for the skin later in time, so we need to make sure that we're actually doing the studies to demonstrate that it's mild to the microbiome, or helping to support and nurture the development over time. Skin microbiome field is an emerging field. As scientists, we're learning more and more about it every day. So how do we translate this complicated, complex scientific discipline to a mom and give her the information that she needs to help her baby? Well, the answer to that is through using or recommending products that have been clinically designed to support the microbiome. So we want to use products that support those healthy microbes and keep them there. And you can rest assured that Johnson's tests all of our products to make sure that they are appropriate for the microbiome and help support and maintain this healthy part of our immune system so that baby can be protected against bad bacteria from their environment.